Can you discuss the Institute's position on site-neutral payment for healthcare services provided by hospitals or in physicians' practices?
Absolutely. So, a little background. So we started studying kind of the trend towards employment and the trend of hospitals purchasing physician practices and also building, across the country, the explosion of hospital outpatient departments that are really delivering physician office services, but in a hospital-owned setting. And when you look at the drivers behind that kind of explosion, it's that physicians make less for the same services that they deliver in a physician-owned practice than if a hospital-owned site delivers that same service. And so we started studying that kind of the implications of that site specific payment on kind of how the incentives for hospitals to acquire practices and deliver care. And we felt there's kind of a fundamental misalignment there, that the whole trend is really to deliver services in the most cost-effective setting possible while delivering the same level of quality, right? That's the whole push when we're talking about value-based care, where that's a really important part of it, is what's the most cost-effective setting. That kind of goes against that whole, trend, right? And it's to the disadvantage, it has been to the disadvantage of physicians being able to sustain their own private practices. When you layer on the fact that Medicare does not update physicians in the physician payment schedule as inflation rises, right? Unlike hospitals, you kind of layer on another level of incentives for hospitals to take over the care delivery for physician services. And we've seen that play out. So in 2012, only about a quarter of physicians were employed by hospitals. And only 10 years later, 12 years later, we're almost at 80% of physicians are now employed by hospitals, and then now a growing array of other corporate entities like private equities, companies, and increasingly insurer-affiliated companies. Like Optum now employs 10% of physicians. There are over 100, and I think 110,000 is the most current number. So but that payment differential that starts with Medicare, but we also see that play out, even amongst commercial insurers that often kind of track Medicare's payment. They really put private physicians at a disadvantage. So we've always been an advocate for leveling the playing field and paying appropriately for the service. That doesn't mean necessarily cutting hospitals down to physicians. It means valuing the service appropriately. And when service costs go up because of inflation, the physician reimbursement should go up as well. So that's really front and center right now, is making sure that we, continue to reflect the inflation in physician payment in Medicare.